And cancer rates in India are rising steadily, claiming lakhs of lives each year. A recent analysis of data from 43 population-based cancer registries, which are PBCRs, covering the year from 2015 to 2019, have shed light on emerging trends across the country. What are these trends? Let's have a quick look. The big picture as far as India's cancer trends is concerned. The lifetime risk of cancer in India as of 2024 is 11%. Now, that's the number as far as the lifetime risk of to what extent the population in India will likely have cancer. Moving on, let's also now take a look at the gender divide. Now, who's more likely to have cancer? The report says, the analysis says that about 51% of cases are for women, and they have a 45% death rate. The rate of women who have cancer, in fact, to the death rate is quite different when it comes to men and women. Men have lower cases of cancer but are more susceptible to dying. So as compared to men and women, the latest analysis now says that women, while are more likely to have cancer, it's the men who are more likely to die of cancer. Moving on, what is that disparity about? What results in that disparity? Now, as far as women is concerned, women generally have breast and cervical cancers which are detected early on, which essentially means that they can be treated early on. But when it comes to men, the picture is very different. Men usually have lung and gastric cancers which are harder to treat and later to detect. Because they are harder to treat and later detected, sometimes very late, they progress rather quickly, as a result of which men are more susceptible of death due to cancer. Now, what is it that makes women suffer the most? When it comes to which cancer women have, it's usually the breast cancer. 30% of women who were analyzed had breast cancer. Next up is cervical cancer. Those are the two cancers that kill women. But when it comes to men, the trend is different. Let's quickly take a look at men. What causes cancer among men? Oral cancer has now surpassed lungs cancer. Earlier, it was the lungs cancer which was killing men. Today, it's the oral cancer which is more likely to kill men of cancer. Moving on, as to what is leading to more oral cancer? Why do men die of oral cancer? And it's quite puzzling actually, because the tobacco use has declined from 34.6% to 28.6% between 2009 to 2017. So while tobacco rate, the consumption rate has declined, it does appear that that reflection has not been made when it comes to oral cancer, because oral cancer is on the rise. So why is oral cancer rising? Because of the long latency from first tobacco exposure. While you may be consuming less tobacco today, but if you consumed tobacco earlier, your health will similarly be depleted, will be affected. Now, alcohol and tobacco use combined is resulting into a more likelihood of people, especially men, suffering from cancer. And then there are other factors as well which are underlying, making men perhaps more susceptible to oral cancer. Oral cancer today is the #1 reason why men are dying of cancer as opposed to lungs cancer. Now, what are the risk factors? It's quite important to understand. Tobacco is still the biggest risk factor when it comes to cancer. Tobacco consumption is killing people, more men than women. Alcohol is also raising risks of all types of cancer, but most primarily 7 cancers, including oral, gastric and colorectal cancer. These 3 to 7 cancers, their risk is higher when it comes to using of alcohol combined with tobacco, which is likely the cause of cancer amongst most men. And then it comes to food habits such as smoking, dried salted meat, spicy food, hot beverage. All of these ingredients are the reason why people today are more susceptible to cancer. 11% is the rate at which people are more susceptible to cancer. Now, infections such as HPV, hepatitis, Helicobacter, typhoid, salmonella, all of these infections also make one more susceptible to cancer. So if any of these infections happened to you at some point of time in your life, in your journey, perhaps you are more likely to also get cancer. But there's also an interesting trend when it comes to regional variation. Now, highest cancer incidents are being reported in Northeast India, which is quite surprising. But if one were to go deeper into reasons, you realize that highest of all cancers, including cervical cancer, is being reported amongst men and women in northeast regions. Why? Lung cancer in women and oral cancer in women is more in the northeastern regions. Let's understand why is that. Men are getting about 21% lifetime risk versus the 11% national average. So nationally, while the average is 11%, men have a 21% risk of getting cancer if they are in the northeast parts of this country, while women, there's an 18% lifetime risk of getting cancer compared to the 11% national average. So both men and women are more susceptible of cancer, of getting cancer if they're living in northeastern parts of this country. Now WHO suggests that cancer is preventable, so there's no need to worry just as yet. About 30 to 50% of cancers can be prevented if early measures were to take into effect or were to kick in. So key reductions are directly linked to lifestyle changes. If you are to change your lifestyle, perhaps it will result in you reducing your risk of getting cancer. Now, HPV vaccination for cervical cancer, that's one of the ways in which prevention can be ensured. Moving on quickly. Screening and early detection, that's another way in which risk of cancer can be dramatically reduced. Now, that's of course as per analysis which is coming to light by the virtue of those cancer registries which are based in India. We need more cancer registries because remember, only 18% of India's overall population currently is covered by the existing registries. But a trend there which is frightening at the moment, but at the same time, remember, cancer is preventable.